Have you found yourself repeatedly checking if you locked your door, washed your hands, or turned off the iron at home? And this may seem harmless or being normal or you being cautious, but to some others it may seem deeper. You're welcome to Health Afrik on AAU TV, and this is brought to you by the Association of African Universities in collaboration with OKB Hope Foundation. And my name is Isabella Teta Henakwa. In today's episode, we'll be discussing obsessive compulsive disorder, one of the mental health issues that affect millions of people worldwide. And in this episode, we will be discussing the symptoms, the science behind the compulsion, as well as the available treatment. We'll go for a quick break. When we come back, I'll introduce the guest to you and then start with the discussion. Please stay tuned.
African Universities Television, AUTV. I just want to say that without the media, you won't know what's going on in the world. Even with the media, you sometimes don't know what's going on in the world. So you need to tune in to the reliable sources who are really on the front lines, who can give you the information you need and give you facts, not conjecture, give you real news, not fake news. And this is the place to find it, AUTV.
The voice of higher education in Africa.
Thank you for sticking with us, and you're welcome back from the break. But if you just joined, this is Health Afrik on AAU TV, and today we are discussing obsessive compulsive disorder. And I am happy to introduce to you our guest for today, Dr. Eric Nanteer, who is a clinical psychologist. He's going to help us understand better what OCD is. Hello, doctor.
Hi.
It's good to have you again.
Nice to have you too.
Great. So I think this is the third time we are having you. Yeah. Yep. Great. Today we are discussing obsessive compulsive disorder. I'll go straight to it. What exactly is this, and then how does it affect someone's daily life? Okay.
So the meaning is in the name, obsessive compulsive disorder. So let's break it down into three. Yeah. There's the obsession, there's the compulsion, and there's the fact that it's a disorder. So the obsession is intrusive thoughts that cannot be controlled. Now, you see how you have your thoughts daily life. In our last episode, we were talking about overthinking. So these thoughts come. At least you have some control of the thoughts. That's why in our previous episode we were saying that you could find alternative ways of thinking. You could try to stop overthinking. But this is different. This one, the thoughts hit at you. They come and then they intrude. So that's where the intrusive thoughts come from. Okay. So the thoughts intrude your normal thought processes, and then there's nothing you can do about it. Okay. It keeps coming over and over and over. Okay. And then there's a compulsion. And for the compulsive bit, you need to act in a way to stop the thoughts from occurring. So for example, I touch this thing here, and then I feel like I've contaminated my hands. Okay. So I need to wash my hand. Now, me touching this does not necessarily mean I've contaminated my hand, but there's a thought that's being inserted into my mind that my hand is dirty now, and that thought will not go away. Okay. It's going to keep hitting at me. Your hand is dirty till I wash my hand, which is the compulsion. Okay. So the compulsion is sort of to quell the obsessive thoughts. Now it's a disorder because this can affect somebody's daily living. Imagine the least thing I touch, anything I touch, I have to go and wash my hand. That's going to take a significant amount of productive time of your hands. Or I would have to go everywhere wearing gloves. I mean, it's going to affect your interactions with people. And just on a lighter note, I think probably people with that kind of condition, they enjoyed it in the COVID period because they didn't have to shake anybody.
Yeah, right. So how common is this? And also, we want to know the people who are at most risk of getting these OCD. Okay.
In recent times, you hear a lot of people saying they have OCD, but the challenge with that is you don't know whether they've been clinically diagnosed or they've diagnosed themselves. Yeah. But in about 2% of the population, or 2 to 2.4% of the population would have experienced OCD at some point. If you take about 40 people, about 4 of them would have experienced having OCD at some point. For some, it's a lifelong experience for them, a lifelong journey. For some, depending on the kind of treatment and then how mild or severe it is, the treatment can vary. The treatment can determine their level of success or the prognosis of the condition.
Oh, okay. So first off, let's look at some of the examples of OCD. You made mentioned you touch something and you feel like, okay, you've contaminated your hand, so you have to go and wash. Or maybe, like I mentioned in my introduction, you locked your door, but you feel like, okay, it's not safe, you have to go and check. Well, what are some other examples of OCD?
So there are various types of, OCD presents in various ways.
Okay.
The most common ones that we know are those who are concerned with symmetry. Some like to arrange things. Some like to walk in a certain pattern. So you see there are tiles, especially small tiles. There are some who want to walk in a certain manner on the tiles.
Okay.
There are some whose movements seem robotic. That's theirs. There are some who like to pull their hair. And then there's this kind of OCD called hoarding. There are some people who they don't want to throw anything away in this life.
Okay.
Once they buy something, so you go to their room or their storeroom, it's full of junk that they just cannot throw away.
Okay.
Yeah, hoarding behavior is also a subcomponent of OCD. There's the cleanliness version, like I mentioned, and there are some who only have. So OCD is the obsessions and or compulsions.
Okay.
So some have just the obsessions, but don't really have the compulsion. That's an and or. If you use the DSM-5, which is what we as psychologists we use for classification of mental disorders. So some have the cleanliness thing, like I said. For some, it's just repeated checking behavior. It could be checking whether it's iron, checking whether it's their door closed, checking whether they've actually washed their hands. So many things. So long as it's a repeated thing for you that somebody will normally do once or twice, and then there's a thought insertion, there's an intrusive thought that makes you want to go and check that thing.
Okay. So looking at the word obsessive compulsive disorder. So let's say I'm in a relationship and I'm so obsessed with my partner. So I keep checking up. Where are you? Where are you? Where are you? Can I also define that as OCD?
No.
Okay.
Well, like I'm saying, there's a criteria for diagnosing somebody as having OCD.
Okay.
Right. And then the first ones I mentioned is the fact that there should be an intrusive thought that keeps coming.
Okay.
There should be the compulsion bit of it, and then it should cause significant distress to you.
Okay.
Right. You being obsessed with your partner, it's something else on its own. There are people with obsessions, right? But depending on how it manifests, we cannot just say somebody has OCD based on that. Maybe the person could have the obsession bit of it and it could be diagnosed as that.
Okay.
But I'm not too comfortable making blanket statements about examples and then giving diagnosis to those examples unless the person has actually been assessed properly.
No, so when will we see that this person has an OCD? I'm talking in terms of the signs and symptoms. What can define, or what are some of the signs that tells that, okay, this person has an OCD? Okay.
So assuming you are late for a wedding, let's assume you're married, you're late for a wedding, and then your husband is probably, maybe let's assume he's driving, because that's what usually happens. He's driving, so he's waiting for you outside, and then you go and then check the door. Oh, you've locked the door. And then he starts driving, and you're like, I need to go and check again if I've locked the door.
Okay.
And then he comes, you are moving again. No, I don't think I locked it. Let me go and check again.
Okay.
And then for the first 30 minutes, we are going back and forth. You get to the wedding, and then there's a thought telling you probably didn't lock the door. Meanwhile, you know that you've locked it, but there's a thought challenging that no, you didn't lock the door. So you are where you are, extremely uncomfortable because you are thinking, I didn't lock my door. If you see something like this, you know there's a problem. You meet somebody, everything the person touches, the person has to use either sanitizer or wash their hands. So usually people like that, you see that their hands are always shiny because they've washed. Somebody with severe OCD can use a whole bottle of soap or a whole bar of soap.
Wow.
In a manner of washing. So they're just there and then wash until the bar of soap is finished. You don't think they've washed their hands properly.
Wow. Interesting.
So let me just move on to this. Earlier I said that a lot of people like to tell themselves they have OCD. Unless you've actually come into somebody who actually has OCD, it seems like a nice thing to tell yourself that you have. Because I see a lot of people, they go online and then they fill some one questionnaire and they're like, oh, I think I have OCD. OCD is not fun.
Okay.
I have a client who came to me very recently and she was almost in tears, like telling me about how bothersome it is for her that she's going through whatever it is she's going through. Because this is affecting the person's life. You cannot go here, you cannot go here because there's a thought telling you that you've not done A, B, C, D. So it's very, very distressing for people who experience it.
Okay. Now, so let's look at, I'm curious to know whether OCD can also happen in terms of children. Do they also experience that?
Yes. So usually OCD starts from childhood and adolescence.
Okay.
You can see traits of that. Unfortunately for children, because children are already hyperactive, it's difficult to tell right from childhood, because you don't know whether, oh, my child is just all over the place, or my child just doesn't like A, B, C.
Okay.
I don't know if you would ask this, but let me just go on with it.
Okay, yeah,
so OCD can be biological and it can also be environmentally engineered.
Okay.
So maybe there's a trait of it in the family. There's that. Then there's also the learned behavior. If you come from a home where your mother is like, do this way, do it this way, for like, let's say you lived with your mother for 23 years of your life, and then that's how she is, there's no surprise that you grew up that way, right? So that's how you learn. So if a child is brought up like that, the child will have traits of the mother. Doesn't mean that biologically the child has got it, even though there's a biological component to it. But just because the child has been brought up that way, and the child is predisposed to having that. But yes, children too experience OCD. The first time I came into contact with a child with OCD, nobody had to tell me that the child has OCD. Because, again, obsession. So he sees anything, he's obsessed with it, and then the compulsions to act on it. As we go, it becomes a little tapered down because of socialization. So you can see somebody with OCD who is older, and then the person manages it. It's still bad, but the person manages it properly than a child, because children don't have that level of inhibition. Right? So the little boy just comes and he's touching everything all over, and I'm like, this is it.
Yeah. So you are saying that, in children, you can't really determine whether it's OCD. Maybe they are being hyper, or they are acting as a child, how they are. So how does it, in a child, we are not too sure whether it's OCD.
Well, there are assessments for that. So the same classifications, if the child has intrusive thoughts, I mean, of course, if it's a child who can speak and then express what they are feeling. So if the child has intrusive thoughts, the child engages in compulsive behaviors, then you can still diagnose a child as having OCD. But I'm saying that I'm a little bit reluctant when it comes to diagnosing children. We want to know whether they will come out of that phase or whether it's actually a problem, because you don't want to give a label to a child at that young age without any obvious reason, unless it's so obvious that this child has OCD.
Okay, so I'd want to know if you wouldn't want to diagnose a child in term or give the tag that he has OCD. At what age do you think, maybe in terms of the younger age, should the parents bring the child if the parents could still see the signs of OCD?
Okay, so if the parent realizes that a certain act or a child has to act in a certain way, or else the child will be in clear distress. So you give your child food, and then the child has to clean his hands immediately after. Children like to eat with their hand in the beginning. So anytime he puts the food in the mouth, he has to clean his hands. If not, he starts, you tell him to continue, then he starts yelling and acting out. It's probably a telltale sign for you.
Okay. Now, you made mention of some of the causes. Actually, I was about to ask that. So there are environmental causes and social causes, as well as you being born with it and all that.
So, with regards to the environmental, I'd like to hit on that. Sometimes parents make their children learn obsessive compulsive behaviors because, again, it comes back to habit formation. If you don't allow a child to learn to be dirty, you have to allow the child to learn to be dirty and then allow the child to learn to clean up after being dirty. But if right from the beginning you don't introduce the child to experiencing dirt, then all the child knows is cleanliness. And imagine going to a boys' school dormitory for about 20 people there, and all you know is cleanliness. You're not going to have a good time in that school. Because everybody is sitting on your bed, everybody is coming here, your trunk, you come back from class and your trunk is opened. Yeah, you're going to be in severe distress if you are brought up like for the first 13 years of your life living in only cleanliness.
Yeah, that's true. And still on the causes, I'm curious to know if traumatic experience as well as stress also can cause OCD.
Yes, there's a component to, so the thing is traumatic experiences can cause all sorts of psychological disorders, and OCD is not left out. So again, if let's assume that somebody witnesses a gory event, right? And then the person pairs that gory event with death or something. I'm using death because that's the most common one we see.
Yeah.
Right. So now, because of that traumatic experience, first maybe the person was okay with handling death. Now, because of that traumatic experience, the person now sees death, and then unconsciously the mind goes back to that gory accident or incident that the person witnessed. So that could also be a precipitating factor for somebody demonstrating signs and symptoms of OCD.
All right. We will go for a short break. When we come back, we'll look at the treatments available as well as what we can do to control OCD. All right. Please stay with us. We'll go for a quick break. Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action. All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review.
Lifestyle tips on fitness, nutrition, fashion, and beauty.
Inspiring interviews with influential figures and everyday heroes.
Performances and interactive contests, and so much more.
In Ethiopia, Salam Afrika. In North Africa, Alan Afrikia.
In Swahili, Jambo Afrika.
Hello Africa, your daily connection to the continent.
You're welcome back from the break. This is Health Afrik on AAU TV, and in today's episode, we are discussing obsessive compulsive disorder. Before the break, we discussed Doc explained what OCD is. We also saw some of the signs and symptoms, as well as the risk factors that contribute to developing OCD. If you just joined, you haven't missed, you can follow the discussions on our social media handles at Association of African Universities on Facebook and YouTube. Okay, Doc, so we are back from the break, and moving on, I think we should look at the treatment. First, the treatments that are available for OCD.
Okay, so before I talk about the treatment, something just popped up in mind about some of the clients that I've seen that have OCD. And earlier we spoke about the fact that you could see it in adolescents and stuff.
Yeah.
Now, before the treatment comes, depending on how long you've had it, your treatments could be more difficult. So early signs to look out for. We probably should have mentioned this earlier.
Yeah.
Let's say you're somebody who likes to lay your bed. I was talking about being in SHS, right? So I remember someone telling me, "Oh, it started very small. I always had to lay my bed. I always had to do this in a certain way," and people started commenting on it gradually. But because now it has become a habit, then the disorder continues from there. Because once you do something for over 5-10 years plus, it's a habit now, you get used to it. So if you see certain signs about you like that, it's probably something you should work on before. But then going back to treatment. So there's psychotherapy and then there's medication therapy as well. Depending on how severe your condition is, you might need both of them. Depending on how mild it is, you might just need psychotherapy. And again, it also depends on how long you've had it and then when you started seeking treatment. Right. So for medications, there's lithium. OCD also comes with some comorbid disorders like anxiety, depression. So sometimes they're being given medications for all those ones as well. Because again, the OCD has an anxiety-inducing component because I get anxious that I've touched death. The fact that this thing is not arranged symmetrically like I want, it makes me very anxious, get palpitations. I need the compulsions to act on it. So I'll be giving like an anxiolytic to calm me down. And pairing that with psychotherapy, it helps. And for psychotherapy, it's usually cognitive behavioral therapy or exposure therapy, where you expose the clients to the feared stimulus. So like somebody is afraid of death, I could introduce the person to something that's not very clean and then see the person's response and then talk the person through that response. If you don't have OCD, this thing seems like a very basic thing to you. Unless you encounter somebody who is actually terrified of death and things that seem unclean. Some components of OCD looks more of an unclean disorder. Because the person always wants to be clean, doesn't want anything filthy touching him or her. Right? So exposing that person to whatever the feared thing is. So gradual exposure, now the person becomes used to it and realizes that, oh, if I don't clean my hand after 7 seconds of touching this, I won't die. Because the way the person's thought processes, if I don't do this, I'm going to get sick, I'm going to die. And you see the way I'm speaking fast? That's how the thought process are coming. Do this. You are not seeing that to you. Why is this person always washing their hands? But the person is having some serious intrusive thoughts that they have to compulsively act against that. So exposing the client to that gradually, and the person realizes that, oh, I can keep this dirt on my hand for 1 minute. So let's say if I'm with my client, I'm like, okay, you touch this. We'll not wash our hands now. Instead of the quick compulsion to wash your hands, let's wait for about 5 minutes. Let's wait for about 10 minutes. So if like after 10 minutes, the person is okay, then we'll be like, okay, go and wash your hand now. Then we do this, we repeat it again. Oh, this time we're going for 20 minutes. Now, over several sessions, the person realizes that, oh, I can have death. Assume perceived death on my, it's not actually death because you just touched it. I can have perceived death on my hand for a while and I don't need to compulsively act on that. So there's that. So there's a psychotherapy bit and then there's a medication bit.
Okay, so if I understand very well, so the medication is basically to calm you being anxious. Is that it?
Well, not exactly. I mean, it has other biological processes to it. So something like the lithium that's given. There are links to other psychological disorders. Like I said, it's comorbid with other disorders. So it's being given to sort of control for all of that.
Okay. So my next question is, can we cure OCD completely, or it is lifelong so far as you have it? I mean, nothing can be done, but you can just take medication just to limit it, and there's the counseling also just to limit it, or we can cure it completely.
I think it's a tricky one because when we are talking about curative measures, we are looking at how you take behavioral steps to manage whatever it is. So again, with the death, if my client no longer has that obsession with death, then we can say that yes, this person has been cured of it. But we can't tell for sure if we rules out the biological components of it. So the fact that you had it before, is there a likelihood that even though now you've treated it, your child might have it because if there's a biological component.
Okay.
But for most of the people with severe, again, it depends on where you fall. If it's mild, it's treatable.
Okay.
Like almost everything. Once it's mild, it's treatable. But those with the severe ones, they might have to be on medications for like, because I know of colleagues who are seeing people who have been having OCD for 20, 30 years plus.
Wow.
Right? But the treatment plan is what will determine how well you'll be living with the condition.
Okay, so it's curable. At the same time, it can be lifelong, depending on how long you've had OCD.
I prefer to use manageable than curable.
Manageable. Okay, right. Thank you. And so, still on treatment, you know, in Africa, even in like Ghana, we normally relate health issues to our culture, the way we perceive it, even the way we treat it. You go to the hospital, a doctor will tell you to do this and this, but the person will go back home and say, my parents said I should do this, or my pastor is saying I should do this. Looking at OCD, are there any cultural beliefs that also determine how people perceive OCD? Or maybe, like you said, I may see a child doing something and you say, oh, I know. That is how kids are. Maybe there are some cultural beliefs that maybe the person is coming from here, that's why the person is doing that. So maybe you've encountered people sharing their cultural beliefs with you to determine or perceive how OCD is and also the treatment.
Okay, because I work more in a clinical setting, I'll have to speak from that experience. I've not had any clients come and then it's from a cultural perspective. Usually what they come with is they're presenting complaints, which is, oh, I feel like I have this kind of thoughts, I have this kind of compulsions, but nobody really comes with, oh, where I'm from, this is how it is. But then generally speaking, or more societally speaking, there are people that we know that, oh, we don't pay fee, we don't pay say, or this household, they are super clean. I have to put a caveat there. The fact that somebody is super clean doesn't mean that they have OCD. But I'm saying that there's a tendency for some small bit to be there.
All right, okay. Thank you for explaining that and letting us know that there are no, maybe to our audience, if there are some cultural
yes, maybe the audience might have listened, but from my own clinical practice, I've not experienced any.
Okay, so now we know that there are some treatments for OCD. Let's look at coping or controlling what are some of the practical strategies we can use to limit or reduce OCD, the symptoms and signs.
So one thing I always tell my clients is, don't try to control your thoughts. The more you try to control your thoughts, the worse it gets. Okay. Because the thoughts are not something you can control. What you can do is to have a conversation with yourself or sort of counter the thoughts that come. So for example, if you have thoughts about death, you can just tell yourself, well, this thing is not going to kill me. Instead of trying to push that thought away. Because the more you try to suppress that thought, the worse it gets. And every clinician will tell you that, yes, that is how OCD works. The more you try to compress the thoughts, it's like the more it triggers. It's like popcorn. You just put it inside and then it's just becoming more and more and more. So one, try not to control the thoughts, but rather try to counter the thoughts with more positive ways of seeing whatever the situation is. And then the other thing is, if you're on medication, you need to stick to your medication because, like I said, depending on how severe it is, the medication can help with the treatment. So for example, if your OCD comes with attendant anxiety, because of the anxiety, you might even find it difficult. Although OCD already itself is an anxiety generating one, so you need the anxiolytic to calm you down so that the psychotherapy will also take place. But if already you are anxious, then the therapy is not going to work.
So maybe I should have asked this earlier. Is there a way you can use to diagnose someone whether the person has OCD? Is it just the compulsion you use to determine or to diagnose that you have OCD, or maybe there are some mechanic ways or maybe a device? I don't know.
Okay, so there are statistical tools, the assessment tools that we use to diagnose someone with OCD. There are so many tools. There are some online, but then we also have our own clinical judgment. And then there's also I said this earlier, the DSM, Diagnostic and Statistical Manual, right? So for that we have classifications and then you have the things to look out for someone with OCD.
Okay.
So you do your assessment, and then you match that with whatever is in the DSM.
Okay.
So yeah, so there's a clear-cut assessment for diagnosing people with OCD. That's why I'm saying that the fact that somebody is super clean or a clean freak doesn't mean that we go about it saying that the person has OCD.
So with this, what would be your advice for someone who may be clean? The person is so clean that every little time, but does not know whether that is OCD or it's he or she being normal. What would be your advice to that person?
To be honest, I don't think I have any advice. It's not bad to be clean.
Okay.
The problem is if it's causing you distress.
Okay.
So anything that's mental health related, we need to consider the fact that we need to consider distress. If it's not causing you distress, it's not causing those around you distress, then it's fine. Being clean is not a bad thing at all. However, if when it's 2 a.m. you have to wake up to clean or else you can't sleep.
Okay.
When you have work at 6 and you have to wake up at 5. But because you think, oh, it's not like your room is very dirty. You've just seen some 1 or 2 things lying somewhere, and at 2 a.m., 1:45 a.m., you need to be awake to clean.
Okay.
That will cause you some level of distress. So if it's causing you distress, then you need to see a professional to help you out with it. But if it's not causing you any form of distress, it's not interfering with your life in any way. And mind you, the people that we see, they've come because it's actually interfering with their lives. I'll give you an example. If you are washing your hands for 20 minutes for 1 hour, what time will you even get to work? How long will you be working? If you are at work, how many times can you get up to go and wash your hands? You finish the workplace sanitizer, only you. Right? It's causing distress to you and it's worrying other people as well. Then you need to come and seek help.
All right. Thank you very much, Dr. Eric Nanteer, for today. As we discussed obsessive compulsive disorder, we hope to engage you again.
Thank you very much.
And this brings us to the end of today's discussion, where we talked about obsessive compulsive disorder. We learned some of the signs and symptoms, some of the treatments available, as well as ways and means you can control it, and what you should do when you begin to feel such symptoms or when you see those signs. My name is Isabella Tetahinako, and I'll use this opportunity to thank OKB Foundation for the collaboration. See you again in our next episode. Bye.